Childhood is meant to be a time of joy and discovery, but for countless children around the world, it is marred by abuse. Their silent cries often go unheard, hidden behind closed doors and beneath the veneer of normalcy. Despite universal condemnation, child abuse persists in various forms, leaving indelible scars on young lives. Understanding the scope and nature of this problem is the first step towards addressing it. This essay will take you through a comprehensive analysis of child abuse, starting with a global overview before zeroing in on the situation in India.
Child abuse is a widespread issue that knows no boundaries. According to the World Health Organization, up to 1 billion children aged 2 to 17 years have experienced physical, sexual, or emotional violence or neglect in the past year. These staggering numbers reveal the extent of the problem, which persists despite global efforts to combat it. High-income countries are not immune. Child abuse occurs at alarming rates even in the most developed nations. The United States, for example, reports that every year, more than 4 million child maltreatment referral reports are received. International organizations and treaties, such as the United Nations Convention on the Rights of the Child, play crucial roles in advocating for children's rights and protections. However, enforcement and implementation remain inconsistent, varying widely between countries and regions. Efforts to combat child abuse must therefore be multifaceted, addressing both the symptoms and root causes.
Child abuse takes many forms, each with its own set of devastating consequences. Physical abuse involves the intentional use of force against a child that results in injury. Emotional abuse, although less visible, is equally damaging, including verbal assaults and threats. Sexual abuse involves inappropriate sexual behavior with a child, leading to severe emotional and psychological trauma. Neglect, while sometimes overlooked, involves the failure to meet a child's basic needs, such as food, shelter, and medical care. These actions can lead to long-term psychological issues, including anxiety, depression, and difficulties in forming healthy relationships. The impact of sexual abuse is profound, often leading to severe emotional and psychological trauma that can last a lifetime. Neglect can severely impair a child's development and well-being, leading to long-lasting physical and emotional consequences.
India faces a significant challenge with child abuse, with millions of children affected each year. According to a study by the Ministry of Women and Child Development, nearly 53% of children in India have reported experiencing one or more forms of sexual abuse. Physical abuse is also rampant in India. The National Crime Records Bureau reported that in 2019 alone, over 100,000 cases of child abuse were registered. These numbers are likely just the tip of the iceberg, as many cases go unreported due to fear, stigma, or lack of awareness. Emotional abuse and neglect are pervasive, often occurring within the family setting. The lack of a supportive infrastructure further exacerbates the problem, leaving many children without the help they need. Efforts to address child abuse in India have seen some progress, but enforcement remains a challenge.
Section 5. Comparing India with global perspectives. When comparing child abuse in India to the global context, it is evident that the issue transcends borders and cultures. However, the forms and prevalence of abuse can vary significantly. In many Western countries, emotional and psychological abuse may be more commonly reported, while in India, physical and sexual abuse are often highlighted. Socioeconomic factors play a crucial role in the prevalence of child abuse globally. In lower-income countries such as India, poverty and lack of resources can exacerbate the problem. Cultural differences also influence the perception and reporting of child abuse. In some cultures, certain forms of discipline that would be considered abusive in other parts of the world are normalized. International cooperation is essential to address the global nature of child abuse.
Section 6. Psychological impacts of child abuse. The psychological impacts of child abuse are profound and far-reaching. Children who experience abuse often suffer from a range of mental health issues that can persist into adulthood. These issues include anxiety, depression, post-traumatic stress disorder, and difficulties in forming healthy relationships. Emotional and psychological abuse can leave deep scars that are not immediately visible. Victims may struggle with low self-esteem, feelings of worthlessness, and a pervasive sense of fear. Sexual abuse in particular has severe psychological consequences. Survivors often experience intense feelings of shame, guilt, and confusion. Addressing the psychological impacts of child abuse requires a comprehensive approach, including mental health support services.
Section 7. Physical consequences for victims. Child abuse leaves not only emotional scars but also significant physical consequences. Physical abuse often results in visible injuries, such as bruises, fractures, and burns. These injuries can lead to chronic pain, disabilities, and even death in severe cases. Neglect, a less visible form of abuse, can also have severe physical repercussions. Children who are neglected may suffer from malnutrition, poor hygiene, and untreated medical conditions. Sexual abuse has both immediate and long-term physical effects, including injuries and sexually transmitted infections. Addressing the physical consequences of child abuse requires timely and appropriate medical intervention.
Despite the devastating impacts of child abuse, many survivors exhibit remarkable resilience and strength. Their stories of recovery and triumph serve as powerful reminders of the human spirit's capacity to overcome adversity. One such story is that of Rani, a young girl from a rural village in India. After enduring years of physical and emotional abuse from her family, Rani found solace and support in a local NGO. With the help of counselors and social workers, she was able to rebuild her life, pursue her education, and eventually become an advocate for child rights. In another instance, John, a survivor of sexual abuse from the United States, channeled his pain into art. Through painting and writing, he found a way to express his trauma and begin the healing process. These stories underscore the importance of providing comprehensive support to survivors.
Preventing child abuse requires a multifaceted approach that addresses both immediate risks and underlying causes. Education and awareness campaigns are crucial in informing communities about the signs of abuse and the importance of intervention. Legal frameworks and policies play a vital role in safeguarding children. Laws that criminalize all forms of abuse and provide clear guidelines for reporting and intervention are essential. Support systems, including counseling and social services, are critical for helping victims recover. Providing access to mental health resources, safe shelters, and educational opportunities can aid in the healing process. Community-based programs that offer parenting support and education can also prevent abuse by addressing root causes. Collaboration among various stakeholders is key to creating a robust child protection system.
Child abuse is a global issue that requires a coordinated international response. No single country can effectively combat this problem in isolation. International cooperation is essential to share knowledge, resources, and best practices. Organisations such as UNICEF and the WHO play a pivotal role in fostering international collaboration. They provide a platform for countries to come together, exchange information, and develop joint strategies. Global initiatives such as the Sustainable Development Goals, SDGs, include targets specifically aimed at ending violence against children. By aligning national policies with these international goals, countries can work together towards a common objective. The need for international cooperation extends to cross-border issues such as child trafficking and exploitation.
Child abuse is a grave issue that demands our collective attention and action. The silent cries of millions of children around the world remind us of the urgent need to address this crisis. By understanding the prevalence, forms, and impacts of child abuse, we can take meaningful steps towards prevention and support for victims. Every individual has a role to play in combating child abuse. Whether through raising awareness, supporting local organizations, or advocating for stronger legal frameworks, each action counts. Governments, NGOs, and international organizations must continue to collaborate and innovate in their approaches to child protection. By pooling resources and expertise, they can create robust systems that prevent abuse and provide comprehensive support to survivors. Let us commit to being the voice for those who cannot speak. Together we can create a world where every child is safe, loved, and free from abuse.